A very good afternoon, everyone. My name is Fahad Shahid, and we are live from our Facebook and YouTube channel, Prime. When you talk about stroke, it's a very important topic to be discussed, as the stroke is similar to what a heart attack. If there is a heart attack, we can say the stroke synonym to stroke would be the brain attack. That's what we are here for today. I've got here with me Dr. Ghulam Shabir, who's the specialist neurologist at Reef Mall Prime Medical Center, and he is going to talk about the signs of stroke. And we just witnessed a stroke day yesterday, which is the 30th of October. We are always Prime is always looking forward to spread the awareness on these important and special topics, which needs to be the information needs to be conveyed to everyone out there. So I have Dr. Ghulam Shabir here with me. Doctor, thank you very much for joining us today here with us. Dr. Ghulam is going to be talking about all the signs of stroke initially, and once he's done with his initial talk, we will be taking question and answers live from our comment section. So we would like to request you to please stay tuned with us and ask your questions in the comment section. Doctor, thank you very much once again.
Thank
Over
you.
to you. The signs of stroke, doctor, that we really need to know, because a lot of people have these symptoms, or any one of those symptoms, but they're not aware of it. So just to react before on time, we would really like to know on all of this. So please, over to you. Thank you.
Fahad, thank you very much for your kind introduction. Assalamu alaikum. Good afternoon to everyone. And today we welcome you people on behalf of Prime Healthcare Group and Personalized Personal Care. This is our slogan. Today we'll talk about briefly regarding the stroke. Stroke, as Fahad mentioned, it's a brain attack. It's something attack. So it's caused by the sudden cutoff of the blood supply to an area of the brain. So if you go to the global figures, as per the WHO, World Health Organization, annually 15 million people are suffering from new stroke. Out of them, 5 million die and 5 millions have a permanent disability. So this is a catastrophic figures and very significant figures. If you compare simply with the COVID-19, even within 2 years, COVID-19 figure is 5 million people died. So in a stroke, more than 5 million people are dying per year. So I think so we should be very cautious about the stroke. It's more dangerous to any disease. This is fourth leading cause of the death worldwide. Regarding the stroke, there are two types majorly of stroke. One is ischemic stroke, another one is the hemorrhagic stroke. The ischemic stroke, the atheroma formation, that is one fatty fibrous tissue. It's made of platelets and some inflammatory cells. It will form inside the blood vessel and it will obstruct the blood flow, and it is causing the stroke that is called ischemic stroke. Another one is the hemorrhagic stroke, in which there's a rupture of the artery due to multiple reasons. We'll go to discuss the causes later on. So these are the two major categories of the strokes. Regarding the causes or risk factors, we will divide them in a physical. We have lifestyle risk factors like our routine life activities, overweight, obese, physical inactivity, alcohol intake, smoking, stresses, and we are taking some medicines called drugs, just like cocaine, amphetamines. Then the medical causes for this: diabetes, hypertension, high cholesterol, cardiovascular diseases, heart failure, then heart valvular diseases of the heart, then some holes in the heart that can cause the stroke as well. And then the rhythm of the heart means the rate of the heart is if it's irregular or if it's very fast. One of the important disease is atrial fibrillation will lead to the strokes. Then there are factors which we call them as non-modifiable risk factors. Those already we discussed, they are modifiable. Now we will discuss about the non-modifiable. Age. A stroke is 60% of a stroke have been noticed in age below 70 years, and 7% of strokes have been noted in age less than 44 years. However, stroke may happen in any age. Then the gender, males are more prone to females for the strokes, and then ethnicity. We have seen Africans, American Africans, they have high tendency towards the strokes, and then the genetic factor, definitely genetic factor having a role, so it could be genetic, it may run in the families as well. Now the important topic, as Fahad mentioned, is the early signs of stroke. We should be aware about this, and this is very essential to know. And why we should know it? Because the whole treatment depends upon that, how much fast we are attending the physicians, we are attending hospital, we are attending the emergency. I will mention, it's very easy to memorize acronym called B fast. So B for balance, E for eyes, F for face, A for arm, S for speech, and T for time. So regarding balance, if someone has sudden onset balance issue, he was fine, suddenly he become feeling imbalanced, difficult in walking, and maybe in the arm sometimes they will note the hand is shaking like that, it's not straight. So if it's sudden onset, think about a stroke and you have to rush to the hospital. Then eyes. There are some symptoms of acute stroke in eyes, just like diplopia. You see double images suddenly. You have decrease in the vision, and then you have also the drooping of the eyelid, the closure of the eyelid. So these the symptoms are, then you have to rush to the emergency. Then face, numbness over the face, half of the face, or there asymmetry in the face, means the angle of mouth is asymmetric, drooling, drooping, then it could be a stroke. Then arm. In the arm, it's very important. If you are suspecting you have a stroke, just raise your arms like this, and you will feel the stroke side arm will go down. So it's called pronated drift. It may go up, but like this. This is also a sign of stroke. If the stroke is huge, you may not be able to lift the arm. So these are the signs of the stroke in the arm, which we should be aware about. Then the speech. Speech is very important. You are talking, suddenly you are not able to talk. There are different ways of this. If you are not talking at all, or you are talking, but your talking is not grammatical. And third is you are fluent. You are talking fluently, but your talking is not relevant. Means you have some interpretation problem. Then the confusion, and you are not able to make decisions immediately. These are the then the time. Time is very important because time is brain. If you reach to the stroke units, to the stroke centers, to the hospital where people are treating acute stroke, you should rush. This will save your life. This will minimize your disability and burden on the family and on the country. So other rare symptoms we have seen sudden unconsciousness. This is very rare, but we have seen in patients sudden onset unconscious. This is happening when one of the danger type of stroke called top of basilar syndrome. Then people having feeling of sudden dizziness. Then people having sudden onset confusion. So these are the common symptoms. If it's acute, if they are unilateral, half of the body, I think so then we should be aware about these symptoms, and we should rush to the medical center to take the doctor advice. Now, the pattern of a stroke. The pattern will be stroke symptoms happened, improved completely. This is called transient ischemic attack. This is how the people are confused. If they have something, they said improved, it's nothing, so I'm fine. But this should not be the matter, because transient ischemic attack will occur in 40% patients having later on stroke. So it should be treated as a stroke. The other thing is happened, progressive, happened, improved, later it came again, so recurrence of the stroke. These are the things we should be wary about. Now, mimics of a stroke, the things which are resembling with a stroke. The important thing is then multiple sclerosis may be resembling with stroke, brain tumors. After the seizure, there's something called torse paralysis. After seizure, there will be weakness of the arm or one side of the body that also comes in the differential diagnosis of the stroke. And the vertebrovascular type of migraine. Again, people may have some symptoms like stroke and headache. So we should be aware about these things. Regarding the investigations, investigations are important. The investigations we usually do lab investigations. We will do CT scan of the brain immediately, MRI, CT angio, MR angiography. We can do the echo of the heart, and then we can do the carotid of the carotid Doppler of the carotids, which are carrying blood to the brain. Now, these are the investigations being done on priority basis, which is more important. If patient is coming to us with a stroke within 4 hours, 4.5 hours, then we should do the baseline work immediately do the CT scan. If it's not, then we can go for the some important treatments which we'll discuss in the treatment options. Now, treatment options which we have, thrombolysis therapy. We can give some medicine which will dissolve the clot completely, or it may minimize the progression of the clot. And patient may have normal flow of blood or sometimes improved flow of the blood. The other treatment is most of the centers have in the America and Europe, and we have some here in Dubai as well, is something called endovascular, mechanical endovascular thrombectomy. If patient is coming within the 6 hours. Now, make sure in certain strokes called posterior circulation strokes, the time limit which we may have up to 12 hours because our treatment options are limited. Then we have options of other treatment. These are the acute treatments people are giving worldwide. The reason we are here to make you aware about the acronym which I mentioned is Be Fast, because if you have these symptoms which we mentioned, you will rush to the hospital. You should get the immediate therapy to avoid from what? To avoid from the mortality, death, to avoid from to be disabled permanently, to avoid from burden on your family, to avoid from the burden on society, and then burden on the country. So we have to be very fast if you have stroke symptoms. Other things which are very important, it is secondary prevention. One is called primary prevention, other called secondary prevention. Now, people having strokes, what they have to do, what we can change, actually that's important. Our lifestyle, we should have a regular walks. We should avoid to put the weight, and we should have to avoid from alcohol intake. We should quit smoking, and our blood sugar should be in control. We should control our cholesterol, called dyslipidemia. We should control our blood pressure, and we should drink plenty of water. That has a very important role as well. So this is all about the stroke. Now I will welcome the questions from your side.
Thank you very much, Doctor. That was a great brief introduction on the stroke. Doctor, I've got some questions that came before the session, and I would like to ask you,
Sure.
Doctor, what does a stroke do to the brain, and how old do you have to be to have a stroke?
Actually, stroke, as we defined, is the cutoff, sudden cutoff blood supply to a certain part of the brain. Blood supply to any tissue is important to survive. So, blood supply will mean the oxygen supply, actually. This is the important. If someone has cut off of the blood supply, it means he having a stroke. Now, regarding the age, as we mentioned, 7% below the age of 45 and 60% below the age of 70 years. However, stroke have no any age. It may happen at any age. In even in pediatric age group, we have strokes, sickle cell anemia, valvular heart diseases, aneurysms, AV malformations, and I think that these are the important causes in pediatric age group. And it may happen in middle age group. It may happen in elderly age. So there's no any age for the stroke. However, it is more common about the age of 45, 450 like this.
Right, thank you. Thank you very much, Doctor. Doctor, moving on towards another question that I have here is, uh, I don't feel like myself anymore. How long are these personality changes and mood swings going to last in case of stroke?
Actually, people have seen a 40% patients of stroke having something called post-stroke depression. So depression, anxiety, stress is quite common in patients with stroke. Why? Because stroke, they will think they are disabled now. They will not be able to work. They will lose the job. They will not be able to support the family. I think so. These symptoms may last for a longer time. There's no any time limit. However, we are encouraging them, need counseling for that, and need social support for that. And definitely at the last, in the last, we can give them antidepressant as well.
Great, Doctor. Doctor, why is it important to get to the hospital as soon as possible when it comes to stroke? As we have seen, you have just said, be fast, the last is time. I think it is related to that directly.
I think so. Yes, we discussed. B FAST is the acronym is important to remember because their brain is time is brain. So if you will be late in the treatment, going to the emergency, you will lose your brain permanently. You will lose your neurons permanently, the part of the brain permanently. So it may cause death. It can cause disability. It can cause a lot of loss of skills, including speech, including writing, including fine other skills. So I think it's very important to reach the hospital immediately if you have the symptoms of stroke.
Great, thank you. Thank you very much, Doctor. Doctor, what can be done to reduce the risk of stroke?
I think so. I would suggest people are suggesting worldwide as well. Lifestyle modification, that's important. We should not put weight, as we mentioned. Our dietary habits, we should not try to eat red meat. We should have less potassium, low sodium, high potassium diet. We should avoid for the junk food. We should avoid from the alcohol intake. We should avoid from the smoking, and we should have a regular exercises. We should have a control of our blood sugar level. We should have a control of our high blood pressure. If we have family history of stroke, we should be more cautious than the other people.
Great, thank you. I have a question from Mr. Jihad, and the question says, "Good afternoon, doctor. Do I have, if I have a permanent brain damage from stroke, and how long it will take me to fully recover in case if somebody is having that actually he means?"
Stroke recovery is a time-consuming process. If you have permanent damage, means infarction in the brain, tissues are damaged. So I think so. It may take months or sometimes years to recover. However, we should do whatever we can do. just like we have to take the secondary prevention from medicine, lifestyle modification, and also we should do regular exercises that includes rehabilitation as well. So brain, then it's a slow process. It may take months and years. However, recovery chances are always there.
Great, thank you very much. Doctor, when a stroke is happening to someone, what should a bystander do?
Actually, bystander can immediately help if something dangerous near to the patient. Number one, the position of the patient to protect the airway of the patient, and also then he has to call the emergency system, ambulance or whatever the emergency system available to rush to the hospital.
Sure. Okay, great. Thank you very much, doctor. But doctor, there is a time when the paramedics arrive in case if you're calling an ambulance. If I think someone is having a stroke, what simple test I can perform before the paramedics
I
arrive?
think so. They will usually the vitals they will check. Number one. Number two, they will protect the airway. That's important, and they will do the blood sugar. They will do the ECG. They should send the sample for CBC to check the platelets, PTINR, and APTT, blood sugar levels, and cardiac enzymes. These things are important. Why these things are important? Because before reaching to the hospital, we should have things in our hand so that we can give some immediate treatment, just like thrombolysis to dissolve the clot. And it will save our time if we will take the samples earlier, because in other countries, in advanced centers, people are giving TPA in the aeroplanes and in the ambulances. They have all, they have CT scan in the ambulance, they have to draw the blood and test the blood in the ambulance, and doctor's team is there, so they are giving even TPA in the ambulance, in the aeroplane. So I think so. These things we have to do immediately.
Right, thank you very much, doctor. I've got a question here. What's the significance of any family member affected with stroke? Is it a risk factor for other family members?
I think so. Yes, definitely, because this is proven in the study, and there is a genetic relationship of stroke. I think so. We have to do genetic studies. Number one, number two, and they should be have regular checkups, and they should have lifestyle modifications.
Great, thank you, doctor. Doctor, you said lifestyle modifications quite a lot of time in your question, in your answers. That clearly means that an obese person will have more chances of stroke. Should I consider it that way?
Yes, obese people having more chance of stroke. The BMI we usually consider. If a BMI is below 25, I think so the chances of stroke will be less. So obese person definitely high risk patient. Other thing I will mention further here, the it's not only obese people have OSA, obstructive sleep apnea, which is snoring at night. Make sure these people are also more prone to the strokes.
They are more prone to the strokes who are snoring at night.
Yeah, OSA, obstructive sleep apnea patients.
Okay, so this is a very important information that needs to be given away to everyone. But doctor, why do people snore? Is it again because of some other particular reason?
Yes, actually, that's true. Because the obstructive sleep apnea is if you have some problem, ENT, blockage of the nose, if you have big tonsils, if your neck is short by birth or naturally in your belly, if you have central obesity, which will hamper the breathing at night and people will snore. I think these things are reversible.
Okay, great. Thank you. Doctor, we've got a question here from Dr. Deepak Nanda. And the question says, are there any chances of people with post-COVID getting stroke?
Uh, People have seen worldwide more strokes in COVID patients. The cause or etiology is not established yet. So I think that we need more studies for that.
All right, great. Thank you very much, doctor. So you would say that COVID, you might not like. Do we relate COVID to the stroke people or chances of stroke?
People have seen hemorrhagic strokes. People have ischemic strokes. They associate, and we have seen in Dubai. We have seen in Prime as well. To establish something scientific in the guideline, it will take some time.
Great. Doctor, we understand all the information that you've given. I want to understand one thing, Doctor. Similar to, let's talk about breast cancer awareness, where if we are spreading, we say that you should have a normal checkup. Is there a normal checkup for stroke risks also, or no?
Yes, of course, because now people having diabetes, people having age 45 or above, and people having hypertension, people having obesity, people having family history, I think so they should have a regular checkup 6 months or yearly.
Or is there a particular name of the test that needs to be done, or
Means
any
these are
X-ray?
the investigations just like blood sugars, lipid profile, your BMI, your weight,
Uh-huh.
these things.
Okay, so that will make a neurologist to understand that.
Sure.
And doctor, likely, if you talk about the statistics overall, the world, who are the people in what age are prone to the stroke more?
I think so. 50 above people are more prone for the strokes than every decade. Every 10 years, there will be a 50% chance of more strokes.
All right. So every decade, but 50 plus will be more prone to that. All right, understood, doctor. Doctor, thank you very much for all of this information. I've got a last question that I really wanted to ask you, doctor. Kids, when you talk about younger people, actually, if we are talking about children, are they higher risk? Is there a higher risk of a stroke? And is this a condition called like? Is it a genetic condition?
Now, stroke in the young age, stroke in the pediatric age group. If someone having genetic predisposition, it may take some time, but they are in the risk. Number one, number two, sickle cell disease, valvular heart disease, and something called CADASIL. CADASIL usually happen in adults, but it may happen in the pediatric age group. So, aneurysmal bleeds, AV malformations, valvular heart diseases, sickle cell anemia, genetic history. I think so. These are the causes in the pediatric age group. That's we are saying stroke have no any age.
Great, thank you. I've got a question here from Dr. Sohail Malfani. You've answered it. If I would request you if you can just give an answer again. Good afternoon, doctor. Is there any lab test which can predict the chances of stroke in near future?
There is no any actually lab test. It's the routine blood test which we discussed earlier.
It's a routine blood test that you've said earlier, like CBC and all.
So, and the second thing is, if patient having young stroke or a stroke in the family, we can do something called hypercoagulable workup. We have certain special investigations, which includes homocysteine levels, protein C, protein S, antiphospholipid syndromes, autoimmune disorders just like anti-nuclear antibodies, and a lot of stuffs we can do in the young strokes patients. Our patients who are risking stroke, our patient young stroke having any heart attack, they may have vascular event in the brain as well. So these are the population which need a thorough investigation.
Great, thank you very much, doctor. I hope that answers the question. Doctor, when you talk about a healthy lifestyle, obviously that includes an exercise also. Is there any specific exercise which would prevent stroke? Or the second part of the question is, in case, is it safe for a person to do exercise after stroke? And what type of exercise will help to recuperate?
Actually, after the stroke, if someone having no any balance issue, they can do the exercises, whatever they can do. Some targeted exercises which should be directed by the rehabilitation team or the physiotherapy team. Otherwise, brisk walk, they can do the cardio. The only issue will be if someone is individually doing the exercises or after the stroke, if it's some balance issue, they may fall and they may cause some subdural hematoma. They can cause some fractures in the bones. And those patients, they need special something called a gait training to overcome the ataxia. And but they can do the exercise. There's no any restriction. for exercise. Exercise is one of the important mode of management in the stroke to avoid from the permanent or severe disability.
Perfect. That's great. That's great, doctor. So, doctor, we have spoken about signs. We've really discussed about the stroke, and you've given the information on the stroke related to how a person should react. Because, okay, one important question that I should say, I think it would be the last question of the day, doctor. A person who himself or herself is having a stroke and nobody is with them, what are the precautionary measures when they feel that there is a stroke they should be taking?
I think so. The immediately, if he's alone, immediately he has to call the emergency system or any ambulance, hospital, any relative they have. They immediately communicate with someone. Or if you know any approachable, then he can call someone verbally as well.
Okay, great, great. Thank you so very much, doctor, for this wonderful information. Dr. Ghulam is here with us, who have given the answers to all your questions, and of course, a very, very informative session on signs of stroke. As he mentioned, and you can see on the screen also, when it comes to stroke, you need to be fast. And he has explained what is be fast, which is definitely an important part on looking after when you are having a stroke, or if you are a standby, you need to look into this precautionary measure. Dr. Ghulam Shabir is currently practicing in Prime Medical Center, Reef Mall. Right now, at this moment, he's there. And if you have any questions, or if you are looking forward to meet him or consult him, he's a specialist neurologist with extensive experience of more than 14 years. You can always book an appointment with our Prime Health Me app that you can see at the bottom of your screen. It's available both in Android and in iOS, or if you do not have the internet for the time being, you can always call us on 047070999 and book an appointment over the call center. So thank you very much for seeing us today. Thank you very much, Dr. Ghulam, for this informative session. It was really very informative. And as we always say, that Prime is all about personalized care personally, that we always look forward to, because awareness on stroke is a very, very important part that we had to play, because it plays an important role, and so does the Prime and the doctors do. So thank you very much. We'll be coming back to you with another live session. Till then, take care, bye bye,
Thank you.
and take care yourself. Take care.